Ultrasound, the advantage is real time. You can actually see the probe going in. You don't have to come out, do the repeat scan, keep going in, keep coming out. You can actually see, and then you can see the ablation happening. You can see some air bubbles forming, actually thing in seen in real time. If you have the availability of CUS, you can do a contrast ultrasound before ablation and then post ablation to make sure that the entire zone is gone. Limitations, of course, include that you need to be careful. It's an operator dependent thing. You should be able to place it nicely and figure out that you've taken out the entire zone. Whereas a cross-sectional image, you can be a lot more clear of the ablation zone. Problem is bowel, bone. These things do not allow you to see the ultrasound. The basic drawbacks of ultrasound will be drawback of ultrasound during ablation also. Of course, lung imaging you can't do through ultrasound. When you end up creating gas bubbles during the procedure of RF or microwave, they also hinder the visualization of the tumor. Feel that you have taken off the entire tumor, but the air bubbles may not have, been the sign of actual temperature change. So they later on they will go away, and you might feel that the it has been taken care of. So it takes a bit of experience to understand in ultrasound that how well your ablation has taken. You have to always sometimes, be dependent on the fact that I've set the right time, right power, and it should take care of this size of lesion. CT, the visualization is better than ultrasound. Maybe MRI is even better, but MRI, the problem is you need special technology that can go inside an MRI. It is very cumbersome, more expensive, more time consuming, not easily available. So all those are the advantages of CT. It is ideal, when ultrasound is limited by either a increased body fat, patient, obese patient, or you're going to hit the lung, you're treating, thorax or bowel is in between. And CT is much easily available as compared to MRI. As compared to ultrasound, the operator dependence is less. You can actually see the ablation zone post the CT. You can keep record for later that this is where the probe was, this is how the ablation zone formed. And problem is the radiation exposure to the patient. Of course, to you it's not that much because you can always come out, but a bit of radiation exposure, slightly difficult to monitor real time. You can, cannot change. You have to come out, see the CT again, then again go back, change your position. It takes a little longer. The MRI, of course, can be used for ablation, but again, the problem is it takes time for the sequences to happen. You need special equipment availability, but it is very good for focused high intensity ultrasound, and tumor conspicuity is better. You can really see the tumor well, but it's really very few places where we use MRI for guidance. Fluoroscopy has limited rule basically for osseous lesions like osteoblastoma, either CT or fluoroscopy can be used. So even in that, we finally end up using CT, which is much better. Otherwise, for some bony osseous lesions, you can try fluoroscopy, not a very commonly used technique for doing the procedure. So complications, the most common complication is that the damage that you cause to the tumor leads to release of some inflammatory material causing myalgia, fever, nausea. This is called post-ablation or maybe a post-embolization, similar syndrome that happens post-embolization. You can have infection in that area, in renal tumors, you can have self-limiting hematuria or chyluria. Sometimes you can have hematomas around the area that was ablated, and you can cause damage to the adjacent structures. Maybe it's a vascular injury, it may be urethral injury. Sometimes if it is very close to the skin, you can cause skin burns. So these are the possible complications that you need to be careful about. Say there's bowel nearby, the liver was adjacent to a colon. So you need to make sure that the colon is not damaged by the heat. So that is one very important thing.